Hello, welcome to Drug Error Talk. I'm Matt Hamilton, and today we're talking about extravasation. I'm joined with Dr. Jesse Garcia. Welcome, Dr. Garcia.
How are you doing, Matt?
Dr. Garcia, what is your area of specialty?
Well, Matt, I am a clinical pharmacist. I specialize in drug errors and the effects of those errors on the human body.
I'm a drug error trial attorney. I represent the victims. Extravasation. Dr. Garcia, can you teach us what that is?
Sure. Extravasation is the idea, and it's very closely related to IV infiltration. So we'll talk about a couple of those. So IV infiltration is the idea that the IV line that's placed kind of backs out, okay?
So you've got a needle hooked to a tube that they're putting it into your body to give you drugs.
Yes. Now, most commonly you'll find that they only use the needle for the placement. They then remove the needle and there's a plastic catheter that remains in place. So that's why it's important to make sure that that is set. The reason being is when you get infusions of any type, whether it be just normal IV saline solutions or whether it be medication, normal medication, or even toxic medications or potentially toxic medications, that medication basically enters what I will talk about as the piping system, which is basically your veins and arteries. Okay, it's just easier to
your blood veins.
The blood veins and arteries. If you think about it as a kind of a piping system where the blood is flowing through there. Okay, so you've now entered the pipe, basically getting the medication into the system, and now the medication can circulate. Okay,
so you've got your blood vessels, and the idea is if the medicine that they've prescribed you goes into your blood vessels where it's supposed to, that's good. Extravasation is when it's going where it should not go. It's not in your blood vessels.
Correct. It's now moving into the tissues outside of the pipes, right? So it's basically leaking out of the pipes, and that could be from an entry point where it's basically making its way into the body.
Does this happen because of mistakes that occur?
This can happen because of mistakes in placement. Certain medications have to be given in certain routes. So some you cannot give through your normal IV. You would have to put it into what we sometimes call a PICC line or central line, which is basically a main line, basically bigger artery. It's put into an area where the medication can be infused at a certain rate and won't damage the integrity of the blood vessel itself.
Okay, so that's what they're supposed to do. How does the mistake happen?
Mistakes happen when the placement is not done properly. Right? It's not put in as it should be, or it's not maintained as it should be. So you need to making sure that it's clean, that the integrity as far as the tape is where it's supposed to be, and that the medications that you're using are to be used via that line. So in some cases, you'll have medications that are intended to be used in a central line, a bigger line, basically. And those medications then are, for whatever reason, not done that way, and they're put into, say, in a line in the artery or in the arm. And so as a result of that, you have medication that's now flowing into a line that's much smaller that could potentially be compromised because that medication was intended to be basically put into a larger line. Okay. So the line can't handle it. Then you have you can have extravasation. You can have IV infiltration, where the medication is actually now damaging the tissue at the site itself. Okay.
So extravasation, this isn't just bad luck. This is an error.
This would be an error.
Okay. How bad can this error get for people?
In some cases, you have to look at what medications are. If you were talking about an IV saline solution, obviously you might have a little bit of soreness, the tissue might be a little irritated, but over time it'll be reabsorbed. If you're talking about a chemical that is dangerous to the skin, you could have basically either burning of the skin, chemical burns. You could have instability, or it could affect the integrity of the skin itself, cause a lot of different problems for that particular site. So in terms of severity, it can range anywhere from a little bit of discomfort to permanent damage.
So these drugs, when they go where they're not supposed to, they kill the tissue that's around them.
They can kill the tissue that's around them, lead you to fevers, risk for bacterial infections. In some cases, if it is a very toxic medication, which some of these more specialized medications are intended to go one place and one place only. They're not intended to be on the outside. They're intended to be inside the pipes.
Okay. Can this lead to death?
It can.
So we're talking about extravasation. It's an error, and it can burn, complications from burn, or even kill somebody from a mistake like that.
Yes, sir.
Okay. If somebody's afraid that they are having this extravasation problem, what should they do?
Well, you're most likely, if you're getting an infusion, you're going to be at the care of a physician, or under the care of a physician, or an infusing clinic. So you're definitely going to want to let whoever it is there, maybe the physician, maybe it's a nurse, someone at the clinic or at the hospital, you need to let them know immediately. Listen, if you're feeling the burn, you shouldn't feel the burn on the outside. The medication should be going in through the veins. If you're feeling it on the skin, you need to say something immediately. You don't want to let it progress forward.
So not only should extravasation not happen in the first place, but whoever's administrating it should also be observing you and making sure that this does not occur so it doesn't get worse.
Absolutely. Because as with any side effect or potential issue, if you catch it early, you have more of a chance to kind of make it right.
Okay. So the worst harms are also a result of a failure to manage and just observe it as it's going in.
Of course.
Okay. All right. And I imagine they should have told you to look out for that sort of thing.
Those are all things you want to be. You should be told to watch out for. But at the same time, while they're infusing the medications, they need to be watching for that as well.
Okay. Well, thank you, Dr. Garcia.
Thank you, man.
We have additional information on extravasation at our website. It's worldwideweb.law-kc.com. In it, you'll find research links and additional information. We've been discussing extravasation and the harm that the drugs going in the wrong places can wreak on the body. I'd also like to send you to our YouTube channel for additional videos which will help you with your research. It's been Drug Error Talk. I'm with Dr. Jesse Garcia, and thank you for joining us. Dr. Garcia, it's good to see you again.
Thank you, Matt.